Hello everyone. This is my video presentation for nursing as a profession. So let's get to it. Starting with my nursing philosophy. My philosophy of nursing involves putting the patient first and foremost. To carry out my ideal of nursing, I will strive to apply therapeutic communication in my nursing practice by listening to the patient concerns, their fears, their questions, and their needs. The ability to integrate both nursing as an art and as a science is equally imperative when assessing patients in reaching their potential health goals. Also included in my perceived philosophy of nursing is the ability to work well with patients by promoting their health, preventing illnesses in patients, and then working to restore their health. I view a holistic approach to healthcare as essential in recognizing the patient as a unique individual by making it a priority to recognize a patient's emotional needs in addition to their mental health and physical health needs. Using an evidence-based practice is crucial in providing the very best care for patients. This practice allows for the best outcomes in nursing by evaluating specific nursing interventions that have been published and by being up to date on national guidelines and standards. Thus, this foundation promotes research nursing practices that contribute to providing quality care. As explored in Barbara Carper's Fundamental Patterns of Knowing in Nursing, nursing involves becoming familiar with the fundamental patterns of knowing. These patterns of knowing are designated as empirics, aesthetics, ethics, and personal knowledge in nursing. Nursing empirics involves having an honest, open relationship with patients in healthcare by viewing a client beyond their state of disease. The aesthetic art of nursing involves being patient and empathetic with patients, devoting time to caring and listening to their concerns. Being able to be an ethical nurse is also essential to the multidimensional aspect of nursing by supporting patients' decisions and being able to advocate for patients. Personal knowledge in nursing takes time to master, and it is important that the nurse in the therapeutic use of self rejects approaching the patient client as an object and stresses instead to actualize an authentic personal relationship between two persons. Critical thinking involves solving problems, especially in nursing situations. The ability to analyze each and every patient's needs and uniqueness will enhance the ability to critically think. Incorporating Carper's fundamental patterns of knowing enhances my views of how I envision nursing philosophy by demonstrating how these fundamental qualities attribute to being a great nurse. The ANA has also set guidelines in regards to a nurse's responsibilities in upholding their commitment to quality care and their ethical obligation to the nursing profession. These guidelines provide a standard of practice and protect nursing philosophies. Guidelines including quality of practice, evaluation, education, collaboration, ethics, research, resource utilization, and leadership all contribute to the nursing process in order to efficiently carry out nursing plans. In addition, nursing theory in clinical practice provides autonomy to nursing and is crucial to the perception of nursing as a professional development. Two important nursing theory contributors include Ida Jean Orlando and Jean Watson. Ida Jean Orlando contributed to nursing with her nursing theory, the deliberative nursing process. This nursing process consists of 5 stages: assessment, diagnosis, planning, implementation, and evaluation. With this theory, Orlando uses the nursing process as a way to provide solutions to problems. Her nursing theory centered on the theme that a nurse reacts to a patient's verbal and nonverbal expression of needs by understanding the meaning of the distress and knowing how to alleviate it. In addition, Jean Watson, 1979's theory, the philosophy and science of caring, promotes humanism, health, and quality of living by viewing nursing as holistic. Watson envisions caring as being universal and being practiced through interpersonal relationships. Watson viewed nursing as being concerned with promoting and restoring health. preventing illness, and also caring for the sick. My current plan for the first 3 to 5 years of my career as a professional nurse involves getting as much experience and exposure to patient care as I possibly can. Therefore, I can envision myself working on a med-surg unit. By working on a med-surg unit, I can apply my knowledge of nursing fundamentals and create a foundation to build upon if I decide to transition to a more specialized nursing field. By gaining comfort in a generalized setting, I can sharpen my nursing confidence, abilities, and skills. From there, many other possible opportunities await. The nursing association that enticed me the most to join is the American Holistic Nursing Association. I believe in their vision of advancing holistic nursing care through community building, advocacy, research, and education. Health prevention and alternative health methods should be accessible to all persons in protecting against illness and disease. Continuing education is essential to nursing, and AHNA's education department offers educational opportunities to nurses to build in holistic practices. Therefore, I would join the AHNA to advocate the importance of transforming healthcare towards health prevention and the prevention of illness by teaching. Nursing as a discipline. Due to nurses' well-defined body of specific and unique knowledge, code of ethics, ongoing research, and professional discipline as stated in Taylor, I agree and view nursing as a discipline. With nursing involving specialized skills and a knowledge-based education, nursing is guided by standards. These standards and visions of nursing propel the profession and have created a multifaceted role of how nursing is viewed. Contemporary nursing issues. Meeting patient expectations. In a poll taken by the Harvard School of Public Health regarding patient stays in hospital, a quarter of sick Americans reported that doctors, nurses, or other healthcare professionals did not provide all the needed information about their treatment or prescriptions. 3 in 10 hospitalized Americans say there was poor communication among the doctors, nurses, and other healthcare professionals involved in their care. Implementing the usage of SBAR can enhance communication. Asking for a readback of orders can also decrease miscommunication among healthcare providers. Addressing imperative information regarding the patient's healthcare teaching should be addressed either before or at discharge to confirm the patient's understanding of any treatments or prescriptions. Important points to consider while taking care of a patient include assessing whether the patient's needs are being taken care of. Before leaving the room, assess the patient for pain, positioning, and if they need to void, in addition to assessing their verbal and nonverbal cues. Even asking the patient about what they expect from their hospital stay is a way to address patient expectations. Empowering nurses in healthcare and gaining the respect they deserve. Supporting fellow nurses and working together as a functional unit empowers nurses to be better at what they do, and as a result, this provides better patient care. Respecting nurses and every other healthcare team member is effective in reaching set goals on a hospital unit. If other members of the healthcare team or nurses are ignored, this only adds frustration and negative emotions, resulting in a hostile work environment, and this should be avoided at all costs. We want to promote a non-stressful, positive environment for everyone, including patients. The words I would want my patients to use in describing myself as a nurse would include being a knowledgeable nurse. By being knowledgeable of proper nursing therapies, techniques, and skills, and being knowledgeable when providing proper patient education. Being a compassionate nurse, being compassionate by understanding the patient and being compassionate in the care for the patient's condition. Being an attentive nurse by being aware, observant of the patient's body language, level of consciousness, and being attentive to their overall well-being. So in the final last moments, this concludes my video presentation for nursing as a profession. Again, thank you very much for watching my video, and I hope you enjoyed it. And here's my references, and take care.